Welcome to Insights. I'm Dick Goldberg, and our subject today, sex addiction. Can this really be a clinically defined illness or addiction? If so, why is it seemingly rising so rapidly? Who's subject to it, and what do you do about it? Our guest today is Dr. Daniel Brakarsh. Dan is a clinical psychologist with 32 years' experience. In the last 10 years, he's specialized in the area of sex addiction. He is a certified sex addiction therapist. Dan, thanks for being with us.
You're welcome.
Let's begin with this question about, is it for real? Is there such a clinically diagnosable disease or addiction, sex addiction?
That's a great question, and at this point in time, there is a fair amount of controversy surrounding it. There is no body of clinical research that supports the existence of the diagnosis of sex addiction. The field is just not at that level of progress at this point.
Well, how do you know you're not a phony? I'm sorry to say that. That's
very
quite
polite. Okay. Well, I know I'm not a phony because, number one, I believe in what I do, and number two, I do see a cluster of symptoms that are that gather together that, to me, make me a firm believer in the existence of sex addiction. At the same time, I don't really, in some ways, care what you call it. You know, some people call it sex addiction. Some people find the word addiction to be highly stigmatizing and instead refer to it as sexually compulsive behavior or out of control sexual behavior. And I think any of those terms will do, actually. At the present time, what psychologists and psychiatrists use to make diagnosis is the DSM-4. Sex addiction is not entered in the DSM-4 as a distinct diagnosis. Mm-hmm. Right now, the DSM-5 is being prepared, and while we don't know what the final draft is going to look like, what seems to be the case is that sex addiction will not be entered as a distinct diagnosis because there's not enough research to empirically support it. At the same time, serious consideration is being given to a diagnosis of hypersexual desire disorder. And from what I understand, the criteria of that disorder will allow people who are struggling with sex addiction to be included under that diagnosis.
Am I correct in assuming, Dan, that in your bones you know it is a diagnosis that's there?
It is. It's much like what, it was one of the Supreme Court justices said about pornography. Mm-hmm. I can't define it, but I know it when I see it. This is quite similar, although I can give you some distinct diagnostic criteria that are used.
Okay, so if someone does have sex addiction, in your opinion, when you see them, what's going on?
Well, what happens is that these are people who are involved in a certain type or types of sexual behavior. Oftentimes, but not all the time, they will talk about feeling compelled to engage in the behavior or feeling cravings to engage in the behavior. The behavior over time takes up more and more and more of their time, and they continue to engage in this behavior despite probable or possible negative consequences. Oftentimes this behavior is done illicitly in secret, and as I said, oftentimes what you see over time is an escalating pattern of such behavior.
Is it any different than other addictions? Could it be, like if you compare it to crack or you compare it to gambling, is it a similar kind of pattern?
That's a great question. People in the addiction field tend to divide addictions into two kinds. There are substance addictions and there are process addictions. So substance addictions are what they say, when you're addicted to a substance, like you pointed out, crack cocaine. A process addiction is when you're addicted to a process. Sex addiction would be one of those. Gambling addiction would be another. Compulsive overeating would be a third. Compulsive shopping or spending would be a fourth. So there are a large number of these kinds of compulsive behaviors which to date have not gotten official recognition.
Well, maybe if you could flesh out, if you were to write the DSM-5 and say, here's what sex addiction is, here are the components, what would you say?
Okay. I would say a person engaging in sexual behavior that is most often illicit or secretive in kind, that it's a behavior which over time demonstrates an escalating pattern, that it takes up more and more time in a person's life, that there are negative consequences associated to engaging in the addiction, but even those consequences are probable or possible for an individual, they continue to engage in that behavior or those set of behaviors.
Now, I know you have a pledge of confidentiality with your clients, but if you could draw a portrait of a quote-unquote typical client, can you share that with us?
You know, that's the amazing thing, because if you look at demographics, there's really no typical client. In other words, I could certainly say that a majority of my clients, the large majority, are men as opposed to women. I could give you that demographic. I could tell you that for a certain group of people who are struggling with sex addiction, owning a computer is quite important in this process. But when we're talking about race, age, income, any of those demographics, this problem really cuts across those lines.
Let me ask the obvious. I think I know this, but why so many more men than women?
Well, that's still subject to study too. I can tell you what I think and conclusions that I've heard colleagues of mine come to. Part of it is that men have a much greater ability typically to detach sex from emotion. Right. And one of the hallmarks of sex addiction is that you're not looking at an emotional attachment in sexual behavior. You're looking at sexual gratification and a bunch of other things.
Okay, side issue.
Yeah.
I have this ongoing fight with my best friend.
Okay.
He says, I say, look, women are looking for relationships. Men are capable of detaching and having sex, and they're much more sexually oriented. He said, no, Dick, that's the dark ages. Things have changed. Women are totally liberated. They go out for sexual adventure just like men.
My opinion is that you're right, but your friend is getting more and more correct as time goes by.
Really?
And I think that part of that, I don't know how much of it, but again, is the presence of the internet and the exposure of pornography at a younger age to both women as well as men. So women are now, I think, especially the younger generation, getting more used to being sexualized and more used to viewing sex in number one, a physical way, and number two, as a commodity that at times they trade for pseudo-connection.
Oh, well now, what about this whole thing about women's pornography as romance novels and men's as pictures of women?
Well, you know, there's this old saying that men fall in love with what they see and women fall in love with what they hear, which is sort of what you're talking about. You know, that men are, I think, much more oriented to visual arousal. I think we're wired that way. I think that there's a neurological component of that, while women, I think, tend to be more wired toward attachment. So that romance novels that accentuate the attachment is very different than a pornographic novel that accentuates pure physical sex.
So therefore, if that's still true, how can women become addicted on the net to sex?
I think it's moving in that direction, both because I think watching pornography on the net can be an addictive process, period.
Well, I know, I bet my booties that 16-year-old boys are sitting there with their friends watching this on the internet.
I think your booties would be safe.
Yes. But I don't see 16-year-old girls watching pictures of boys naked on the internet.
No, they might. They are watching pictures of couples having sex. Again, it's not as common. I mean, we're talking in relative terms here, but I think that pornography is being viewed more and more often by girls. I personally don't think it will ever reach the level that it reaches with guys because of that association between visual and sexual arousal.
What percentage of your clients or in the nation do you think are women versus men for treatment for sex?
I don't know if my clientele is representative. I would say that in my clientele it's probably about 90-10. 90% men, 10% women.
Well, in preparation for this, I read the Newsweek, they had a big cover, sex
Yeah,
addiction.
I didn't
They
get
said
to read
the same,
it, but did they
number,
give the same
90,
number?
90,
Yeah.
10, so that
Yeah.
would be the national. How big is this problem? How many people?
Well, it's a hard thing to measure because it's not like if you do a survey on sex addiction, you're going to get people to come out of the woods and say, "Oh yeah, I'm a sex addict." Estimates, and to be honest, I don't know how these estimates have been gotten, suggest that there are at least 16 million sex addicts in the country. So it's a big problem.
16 million.
16 million.
It's huge.
It's huge. And I think it's getting bigger.
If you compare it to other addictions, gambling addiction, is there more gamblers addicted? Or,
I'm sure there's data on that. I don't know what it is, but I'm sure that sex addiction is up there.
Yeah, you're talking percentage-wise, like 5% of the population. That's enormous.
It is enormous.
Wow.
It's enormous and it's frightening.
If you look back 20 years ago, what do you think you would have found?
Less. I think that sex addiction has always been around. Mm-hmm. The fellow who coined the phrase sex addiction is a fellow named Patrick Carnes, who in the 80s wrote the first book about it called Out of the Shadows. Mm. And I forgot what I was going to say.
That happens, Dan.
Yeah,
I know the
good.
feeling. But the question of how large this is in America, and I suppose the world, and why the rise.
Oh, the rise. Thank you very much.
You're
Dave.
welcome.
So what Carnes says, and I think he's right, is that the Internet is the crack cocaine of sex addiction.
Yeah.
That I think that the Internet has led to a huge increase for three reasons. Number one is accessibility. So with a click of a button, you're at a porn site or at a sexual chat site or at a dating site or at a site where you can find women or men who are interested in having affairs. Mm-hmm. So one thing is the accessibility. The other thing is the affordability. Much of this is free or very low cost. And the third is the seeming, and I underline the word seeming anonymity, in that people think that when they're on the Internet and when they're engaging in porn, it's just between them and their computer and there's no record of what they're doing or anything like that, which I'm not a computer geek, but my understanding is that's not the case. That data is being kept somewhere up in the sky.
Well, yeah, and certainly child pornography points to that with all the arrests of people who've been found to have it on their computer.
This is true.
Yeah. I'm wondering, I might be getting a little ahead of themselves, but for men, I assume most of this is between them and their computer. They're going to porn sites and they're overdoing it. But also, there's a lot I've read in preparation for this to talk about men having so much sex with so many different women. Mm-hmm. Is that fit for what you know?
That does fit for what I know. Again, there's an incredible accessibility on the computer for that.
Tell me, I'm ignorant on this.
You're ignorant on this. Well, so there are a number of different things. First of all, you can, on the computer, you can go to sexually oriented chat sites where you're chatting with other people, and oftentimes these chats become sexual in nature and they can lead to sexual liaisons. So that's one.
But if 90% of sex addicts are men,
mm-hmm.
and 10% are women, how does that match up?
Well, you might want to bring me back to talk about love addiction, because that's another concept that's gaining more currency. And the thought is that there are women out there who are desperate for this sense of connection and, in fact, addicted to the rush that brings with it. Mm-hmm. And that they use sex as a commodity to get that emotional connection.
Oh, my, this is a classic that goes back forever.
Forever.
Men and women, first time having sex, and he says that was great, and she says, do you love me?
Exactly. But it's so much easier now, and it's so much more accessible now, and it's so much more tempting now because of the accessibility.
It always seemed, this is out and out bias.
Go for it.
Always seemed dumb to me when women would go have sex with a guy and then say, but do you love me? Isn't that silly?
I think it's silly from a male perspective. I understand where these women are coming from. I think that it's misguided and it's a reflection of their own neediness.
Well, what are they thinking? If the guy doesn't say I love you and then they have sex, And then she says, "Do you love me?" What is she thinking?
Well, my guess is that in this day and age, it would be interesting if we could figure out a way of doing a survey on this, Dick.
Yeah.
That in this day and age, the "Do you love me?" question doesn't come up after the first sexual encounter.
Oh, okay.
But my guess is that it will come up sooner for a woman than a man. I would also guess, though there's no survey on this, that in the sexual chat that occurs, women are more interested in developing a relationship online before meeting than men are. But I think that's a big generalization. Going back to the whole issue of men and women meeting on the internet and having affairs, I don't know whether you know this, but there's a site out there called ashleymadison.com, which essentially is a site for married people wanting to have an affair.
This would be true in any town because we're talking to people around the world here. Every town would have a site like that.
Well, this is a national site.
Oh, I thought you were saying Madison.
No, it's called Ashley Madison, interestingly enough.
Okay.
But it's a national site.
Oh, okay.
Yeah. And so married people looking for affairs will go on this site and meet people. I don't know whether you've noticed, but Ashley Madison has had advertising on television.
Oh, my gosh.
And they even were trying to get an advertisement on the Super Bowl last year. It wasn't allowed, but they had very sexually provocative advertisements showing, a man and woman falling into bed together and starting to, make out in a very passionate way. And then it would just say ashleymadison.com or something like that.
Oh, my goodness.
Yeah, so this has come farther than you might be aware of.
You're right.
Yeah.
I had no idea.
Yeah.
Any idea the numbers?
I don't.
Must be a lot if they want to go on the Super Bowl to advertise.
I would think. I mean, there are other things that go on now. For instance, for people who have iPhones, there are certain apps that you can download, and you can be in a city, and you can access this app, and you can find how many people are in your area who are interested in having sex.
Okay, now again, the male-female thing. If you're a guy...
More men than women.
Well, wouldn't it be... if you look at gay men, how does sex addiction different for gay men than heterosexual men?
It's not really. I mean, other than the fact that for heterosexual men, it's focused on women, and for gay men, it's focused on men. Not a big difference.
I would hypothesize, Dan, that there would be in that... you're the expert, but men are, as you say, more visually oriented, more lustful, and so two men, my goodness, they can go at sex all the time because they want sex. It's not that "do you love me" thing. So I would think gay men who are sexually addicted would have an easier time finding sex partners and might just wear themselves out more so.
If you're talking about having an easier time, I think that's probably true.
Yeah.
I don't know about the wearing out part. It brings up another interesting issue. I don't know whether you want to address it today, but it's the issue of how much is sex addiction really about sex? Which is a whole nother area of conversation. You can't do that
and not talk about it now.
Well, I'd be glad to talk about it with you. So what I believe, and fortunately it's backed up by others, but this isn't settled because, again, this is a young field and the empirical research is lacking, is that for a sex addict, what sex is a vehicle toward getting a certain fix. And when I say fix, I can talk about that on the neurological level, even though I'm not a neuroscientist and I lack the precision of a neuroscientist. So sex is a vehicle toward getting that fix, just like gambling is a vehicle towards getting that fix, or overeating. So the goal is the fix.
What is the fix?
Well, on a neurochemical level, my understanding, and again, I think this could be better articulated by a neuroscientist, is that when a person is repeatedly viewing sex addiction, their brain is getting flooded with a whole bunch of feel-good chemicals, the most well-known being dopamine. Yeah. Now, our brains aren't used to that degree of flooding, but what happens over time is that our brain literally gets addicted to needing that high level of dopamine. So that when a sex addict says that they have a craving for sex, what they're really saying is that they have a craving for that fix of dopamine,
the chemical high.
The chemical
and
high.
I assume you'd find this in other addictions with other substances or processes.
I believe you do. I believe you do.
Can you take us down the path of someone in terms of what are the negative consequences to their lives when they go down this path?
Sure. So, first and foremost, though, it's not the negative consequence that sex addicts tend to focus on until they're quite a ways into treatment, is what it does to their own soul. So these are people who are walking around with a private life. It's a private life that's shameful to them. And as a result of that, they really cannot enjoy interpersonal connection the way you or I can, because...
Can you hold that thought?
Sure.
What's going on in their life that's so shameful? Is it shameful to go on the computer and look at pornography? Why is that so shameful?
It's shameful if you're doing it in secret from your spouse, right? It's shameful for them if they're doing it at a frequency which they're starting to neglect other obligations, whether it be at work or spending time with their spouse or spending time with their friends or spending time with their kids. It's shameful if they start spending a lot of money on it and they have to keep that a secret. So there are a lot of levels of shame, and it's all wrapped up in secrecy. So that if someone says to them, gee, I really admire you or like you or love you, what's going to go on in a sex addict's head is, yeah, if you only knew.
Yeah.
So sure. It's very tragic from that point of view.
How many, in terms of their day, if they're full-blown sex addicts, how much time might be involved in this?
It depends on how much the problem has progressed. So I will see people who are involved in looking, say, at pornography 2 or 3 times a week for a number of hours at a sitting. And I will see people who are involved for 3 or 4 hours a day, every day, for hours and hours and hours. And if they had more access, it would even be more. So again, it's quite a wide range, but they're joined by this drivenness to do it.
This might be a little technical or a little gross, but is there high the orgasm or just doing it?
Interestingly, the orgasm is not the high. Typically, when you talk to these people, the high is either in the preparation for it, or more commonly, if we're talking about internet addiction, in the searching for the perfect picture or the perfect chat partner or the perfect site. That's where the high gets going. And most people will say, once you're actually having sex, once that happens, that's the start of the decline of the high.
Wow. Interesting.
Yeah.
So what is the point that, I kind of interrupted you, but I
That's
think you
okay.
sort of answered anyway. What is the point that brings someone in to see you? What's the breaking point?
Yeah, usually, I would say, again, 90% sounds like a good figure. 90% of the time, it's because of some external event. So the most common external event is, with the fellows who I see, is their wives catching them. That's by far and away the biggest event. Other events that will bring a person in are their employers catching them. Sometimes they'll get to a point where they're in such bad financial shape that they can no longer hide it from their wives.
Is that because they're using prostitutes?
It's because they're using prostitutes. It's because they're going on online paid pornography or dating sites. It's because they get hooked up with women who aren't prostitutes but who are in need, and they start giving them money to help them out. So it can have a pretty significant financial consequence. If people are self-employed, it will lead them to start to ignore their work. And obviously that leads to a loss of income, so there are financial problems there. There can be health consequences at fine. I mean, some men get found out by their wives because they've given their wives a sexually transmitted disease, for instance. Sure. So those tend to be the most blatant negative consequences, separate and apart, as I said, from what it's doing to the person's soul.
Sure. What about, does it ever happen that a couple are both sexually addicted?
Yeah. Yeah. I haven't run into a couple who are both sexually addicted. What I've run into are individuals who are sexually addicted who are having affairs with someone else who is sexually addicted. And that's an incredibly powerful chemistry for both people because they're sort of kicking off each other's dopamine all the time. And it's an incredibly intense and powerful experience. And it's quite challenging to try to talk a sex addict who is involved in this kind of relationship into the fact that they have a problem.
Wow.
Yeah.
Once they come in to see you, how's the success rate?
You know, I've never done a follow-up. You know, I could probably be brought to task for that. I mean, people should be.
Well, most therapists don't.
Yeah, unfortunately not. My guess is that so part of what's tricky is how do you define success? So do you define success as never ever 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 having a slip, never ever say going to the computer again? So that makes the definition tricky. But let's put that aside for a second. I would guess that my success rate after I engage someone in treatment is somewhere around 70%. Now, the after I engage someone in treatment is a key thing in that a lot of people who I believe are struggling with this are coming in with a very high level of denial. And I'm not always able to help shake that denial, and at that point they leave treatment.
When they do buy in, how do you treat them?
Well, so there are a number of components to treatment, and these are being listed in no obvious order. So one component is that you need to evaluate these people for any sort of underlying psychiatric disorder. Are these people depressed? Are they anxious? Are they suffering from obsessive compulsive disorder? Because these can oftentimes be concomitants of addictive behavior, as well as attention deficit disorder. There's a very high correlation, interestingly enough, between addiction and attention deficit disorder. And people aren't sure. They think maybe it has to do with the fact that when a person is, say, focused on pornography, it shuts out all the other noise.
I see.
But it's theoretical at this point. So one of the things you're going to need to do is evaluate people for these underlying psychiatric disorders and get them treatment if they need it. Sometimes that treatment would involve therapy. Sometimes that treatment would involve medication. So that's one level of it. The other level of it, or another level of it, is that you need to engage people in learning the tools to develop what's commonly called abstinence. Abstinence means you're no longer engaging in these sexual behaviors. In the recovery community, this is called acting out. So you're no longer sexually acting out. And there are a wide variety of tools, cognitive tools, behavioral tools, that can be used to help people not act out.
Is it any different than any other addiction in terms of treatment?
Well, it's obviously different in terms of the content that's being addressed. Some of the behavioral tools are somewhat different because there are some unique aspects to sex addiction. Like, for instance, you can't get away from sex the way you can get away from cigarettes. You're constantly being bombarded by it. The access to it is much easier than the access to cigarettes. So that leads to some different interventions. But with all addictions, I mean, the thrust of the interventions are to help the person regain some sense of management over their addictive behavior.
Is there anything like groups, like in the AA groups?
There are. So the analogy to AA groups in the sexual addiction community are SA or SAA groups.
Standing for Sex Addiction.
Sexaholics Anonymous, I believe, is SA, and Sex Addicts Anonymous is SAA.
And people stand up and say, I'm a sexaholic.
They do.
Wow.
They do. And I don't know how much this broadcast is focused on Madison, but I could even say all across the country there are SA and SAA groups meeting every day of the week. And this is also an extremely important component of sex addiction treatment for a whole bunch of reasons. Carnes called his book Out of the Shadows, and what these groups allow people to do is come out of the shadows and share their story with other people. It's a place for them to get support. It's a place for them to get mentorship, which is called sponsorship in the recovery community. And it's a place for them to also do the 12 steps, which can be a really transformative experience. It's very similar. And there's a analogous group to Al-Anon for affected family members that's called COSA. Don't ask me what the initials stand for, but it's for affected family members of sex addicts, and there are also very active meetings of that all across the country.
And Dan, your future in this business, you think it's still strong?
Unfortunately, yes.
Thank you very much for being with us, and I hope you'll join us on the next edition of Insights.